In Kigali, Rwanda, the African Health Agenda International Conference takes place. Prior to this conference, there's a youth pre-conference. More than 250 young professionals and future leaders from across the African continent unite here in the Kigali Convention Center, where the youth can contribute to the debate on health on the African continent.
Youth engagement in ending female genital mutilation is important because 60% of the African population is under 25, and we are the change makers, and we will end female genital mutilation in our generation.
They will voice their needs and priorities on universal health coverage and sexual and reproductive health and rights.
I am excited to be here at the Africa Health Agenda Conference in Kigali to be re-energized to do this work and to network with others.
I want to join youth because anything for youth without youth is against youth.
I'm so excited to be here because I really want to learn more on how we can advocate for access to SRH services, especially for the vulnerable communities and for youth with disabilities.
During my town hall, I was talking mostly about my experience as Cynthia, as a survivor of FGM, and I was also talking on the different approaches that we are using in actually trying to achieve the end of FGM by 2030. We are trying to really try to eradicate the cross-border kind of a movement, in that the people are moving to other countries to actually take the girls through the cut. And now, since it's an emerging issue, I really loved to really telling the people on how addressing this kind of cross-border.
No more pain. No pain. No more pain. No more pain.
Youth and health workers, they can strengthen the health systems together. Means the youth must have a confidence to go to the health workers, to talk to them, to talk to their problem. Together, if the youth and the health workers have that trust, they understand each other, and then the health workers can advocate for the youth and facilities and youth engagement in health, as well as the youth can help the health workers to reach the other youth who are needed, and like disabilities and as well as the deaf.
Hi, this conference was amazing. It was great also engaging with people that were scared of, like the ministers, and now we're able to take selfies with them, and it actually motivated us on how to push the agenda for universal health coverage.
We got to learn a lot about health advocacy, and I really enjoyed how the things that I learned from Global Health Corps just ties in so well with everything that we've learned here.
But most importantly, what I learned was that what youth are struggling with in Kenya, in Uganda, in Rwanda, and all these other countries that got together here, whether they are uniform. So we are not different, and we can find solutions together.